Pop quiz. A patient receiving IV phenytoin develops hypotension and bradycardia during administration. What is the nurse's priority action? A. Slow the IV infusion rate immediately. B. Discontinue the infusion and flush the line with normal saline. C. Increase the infusion rate to complete the administration faster. Or D. Reassure the patient that this is a normal reaction. And guys, the correct answer is A, slow the IV infusion rate immediately. So what's happening is it's being given too quickly. This drug, you cannot, in an adult, you cannot give more than 50 milligrams per minute. You can't, not in an adult. So you're going to slow it down. B, let me tell you why B is tricky. You're not going to discontinue it, but the second part where it says flush the line with normal saline. Yeah, after administration, you're always going to flush the line. And here's the reason. And you're going to flush it with normal saline. This medication is very, very, very irritating. I mean, if extravasation occurs, that patient will have pain, they will have swelling, they will have irritation, they will have inflammation. We don't want that. It's very irritating. So you're going to make sure that you flush that line after the administration. But I'm telling you, if they start to develop bradycardia hypotension, you're giving it too fast. And here's another thing you need to know. This drug, if the patient, like the doctor orders this drug, right? By the way, this drug is Dilantin. It's an anti-epileptic drug. The doctor orders it, or nurse practitioner, whoever orders it. And you look in that patient's chart and you see that that patient has a history or they have a diagnosis of a cardiac condition that causes bradycardia, you're not going to give that drug. It's contraindicated, okay? You're going to hold that drug and you're going to call the healthcare provider and say, hey, did you know the patient has XYZ? You're not going to give it. There was something else I want to tell you about this drug. Contraindicated. 10 to 20, that's the therapeutic level. You need to know that. 10 to 20, therapeutic level. Oh, here's what else. This medication, it can be given PO. It can be given IV. You can give it push, but if you give it push, it's going to be given what? Very slowly. You cannot give it sub-Q. You cannot give it peravascularly because let me tell you something. You give this drug peravascularly, you have a bigger set of problems that you're going to be concerned about. You're going to be concerned about compartment syndrome. You're going to be concerned about nerve damage. You're going to be concerned about necrosis. So stick to IV, PO. And I feel like there's one more important thing you have to know about this drug. I'll make another video if I can think of it. But for now, make sure you know all of that.